Thea Care welcomes you to a recorded webinar on the topic of menstruation and mental health. We are in conversation with Anuhya Korrapati, a women's health researcher and the founder of BeyondBlood. In this video, you will find answers to all your questions around PMS, PMDD, how to know the symptoms, how to visit a doctor and get a diagnosis, and what are some remedies to manage this in the comfort of your homes by yourselves. Do take a close look and thank you for joining. So, Anuhya, why don't you start with, telling us about all the work that you're doing?
I'll first start off with why menstrual mental health is very important. The reason why it's very important is because evidence shows that any existing mental disorders usually start presenting symptoms when somebody starts menstruating. So that's when somebody, say, develops depression, or if they have a genetic component to it, especially depression, anxiety, and adverse reaction to stress, increased risk behavior, all of that. And it's at the time where teenagers, their prefrontal cortex is not even developed, so it might have a higher impact on the intensity, and the feelings are also very intense. So that is one of the reasons why menstrual mental health is important. And when we talk about menstruation, we're talking about our entire cycle here. So depending upon our hormones at each cycle, our response to our neurotransmitters respond differently to the hormonal levels in our bodies, because of which it impacts our mental health. So when I say menstruation and mental health, I'm not just focusing on menstruation, it's rather than the entire menstrual cycle. And our life is nothing but series of menstrual cycles. So that's why it has a huge impact on mental health. And coming to the work BeyondBlood does is we focus on mental health and menstruation at a very broad area. That is, we focus on the impact of menstrual disorders on mental health, impact of reproductive disorders on mental health, impact of metabolic disorders on mental health, and obviously our biggest focus is the premenstrual disorders and mental health. Here we deal with PMS, PMDD, and PME. As of now, we haven't technically worked or received any complaints with respect to PMS, but we did help out a lot of individuals who suspect that they might have PMDD and PME.
Yeah, I had muted myself. Anuya, may I suggest that if possible, if you could use your earphones, because there seems to be an echo. Is that possible?
Right. I did have my, Bluetooth, but it's not working, and all of my other earphones are chewed up by dogs.
Oh, okay. All right. So we will try to, if there is any sound correction that has to be done, we'll try to do this in the video that we'll be sort of cleaning up a little at the end. So this is to all the attendees. If you can't hear clearly right now, I've got my earphones on. If the problem continues, we'll clean up the video before circulating this. All right. So, Anuhya, the most important question that people ask us, and it is something that is so important to address, that what is the difference between PMS, PMDD, and PME? This is something people don't know so much about. Can you run us through this?
So when it comes to PMS, you usually have 150 symptoms.
Yeah.
And you might be experiencing any of those 150 symptoms. Usually studies say that women experience more than 2 symptoms for PMS, but based on my research, I've seen that women experience on an average of 6 symptoms when it comes to PMS. And that includes breast tenderness, irritability, bloating, change in weight, diarrhea or constipation, all of these things. And how I would say the biggest thing to differentiate between PMS and PMDD would be the intensity of the symptoms. Suicidal ideation is one of the biggest and the most debilitating symptom somebody with PMDD experiences. That includes mostly passive suicidal ideation. It's just an image or this recurring thought that, okay, everybody is going to be better off. I think my life's not worth it and I need to kill myself, things like that. But another characteristic of PMDD is rage. This intense rage that builds up throughout the day till you finally explode on something really small. It can be that somebody touched your favorite towel, or somebody followed you on Twitter or something. It just really some small thing that sets off, because that rage been building inside a person for last, I think, probably 10 days or 14 days, because usually they experience symptoms between 10 to 14 days before they start menstruating. And how PMDD is different from PME is that in PME, there is an underlying psychological condition a person suffering from, let's say depression or anxiety or stress. This is exacerbated by during the premenstrual phase. So you might be dealing with depression throughout your life and throughout your cycle, but it's during the premenstrual phase that you experience increased intensity to the existing disorder. So that's why it's called PME, because premenstrually the existing condition gets exacerbated.
Anuhya, as you know that there is people say that there is no research on PMS, PMDD, which is true to a great extent, but there is enough research now to debunk some. So, can you tell us what the research now conclusions about menstrual mental health?
All right. One of the biggest myths that comes when it comes to PMDD is they assume that it's because of hormonal imbalance that somebody is feeling that way. But that is not true. PMDD is a hormone-based disorder, but it's not because of hormonal imbalance. It's because there is a certain gene receptor in your GABA system that's essentially the neurotransmitter system that makes you feel happy and energetic and all of that stuff. And that gene is not responding well to the natural change in estrogen and progesterone throughout the menstrual cycle. Essentially, what's happening in PMDD is your brain is having an allergic reaction to the natural rise and fall in the hormones. Studies have conclusively proven that there is no connection between hormonal imbalance and PMDD. It's rather the abnormal reaction to the natural rise and fall in PMDD. So there is a lot of research that's happening in PMDD, which identifies 3 different pathways to what could possibly explain it. But one of the good news is that they have been able to find that particular gene that is responsible for this abnormal reaction to rise and fall in hormones. So there is conclusive evidence that PMDD exists. There's been a lot of research. If you go back to the second wave of feminism, you see that PMS was a big deal at that point of time. In fact, there was a point of time where 2 women were exonerated of murder because the defense was PMS. So which is why the DSM decided that, okay, we need to do something about this. We cannot let this be like a sort of disorder that people can use as an excuse to murder other people. So that's why there's a very strong opposition to understanding PMDD and PMS, because it's rooted in stigma and taboo, and it's also rooted in understanding that women itself, especially the third wave feminists, were very scared that, okay, if men understand that our brains react differently to our change in hormonal levels, they're not going to give us positions that we deserve, leadership positions. So they were very scared. So third wave feminists kept pushing away that research, and they were like, you know what, we don't want to acknowledge this. But because it's become such a huge problem with our increased population, we now have 1 in 10 women who suffer from PMDD. And because it's such a huge issue, and because there's a lot, 30% of individuals with PMDD will attempt an act of suicide. And it's about there's this common saying that says PMDD awareness is suicide prevention. So that's why it becomes so important to understand PMDD. And that's why they went a lot of research into it, because of which we were able to understand what exactly causes PMDD.
Okay. Okay. Sorry. Can you hear me? Okay. That's okay. That's okay. I'll unmute you when you are speaking. I think the echo is happening because of the computers, headphones, something, something. So I'll unmute you when I'll mute myself when you are speaking, and I'll mute you when I'm speaking. I think that should solve the echo problem. All right. So I think some people are asking what is PMS and what is PMDD. I think the full form is not very familiar right now. So if you can, quickly give an introduction to what is a full form of PMS, what is a full form of PMDD, PME, and then if you can tell us, what what is the way to get a diagnosis. The first thing people ask us is, should I see a therapist, should I see a gynecologist, should I see an endocrinologist, what should I see? So what is the first step if you feel that, okay, somebody's feeling that, oh my god, I am in extreme pain, I'm vomiting, I'm fainting, I'm feeling suicidal, whatever it is, what is the first step that you can take? Who do you ask for help?
Menstrual syndrome, menstrual dysphoric disorder. The word dysphoric says extreme state of stress or mental disruption. PME is premenstrual exacerbation. This is when a certain underlying condition is exacerbated. For example, depression. The intensity of the depressive episode might increase premenstrually, and if it does increase, that means that you might be having PME. Now, coming to diagnosis is it's actually a very good news. Recently, International Classification of Diseases, that is governed by World Health Organization, gave an official status to PMDD. It's in ICD-11, and it says that it is a mood disorder. Before 2019, if you had to get diagnosed, you would have to get diagnosed by a mental health professional, because it was only in DSM, and DSM is used only for mental health disorders. And if there is something only in DSM, that means only a mental health professional can diagnose you. But because we now have ICD since, I think it's been a year, if I'm not wrong, PMDD is in ICD-11, and that means that yes, your gynecologist can diagnose you. If obviously, if she has a knowledge, if she or he has that knowledge of PMDD and how to diagnose it. But since in India, we don't really have much of awareness, even in medical discourse, about PMDD, I think the first step to do is to do a self-test. So if you go to our website in BeyondBlood, you will have a link to a test. It's a self-questionnaire where you can check whether you have PMDD or not. You just answer these questions and then it gives you. And if it tells you that you might have PMDD in the test, what you do now is you download an app. It's called Me Be PMDD. This app was specifically made for individuals suffering from PMDD so that they can track their symptoms. So now the diagnostic criteria is in such a way that one must be experiencing these symptoms for more than 3 months to be diagnosed with PMDD. And so you'll have to track your symptoms. And the Me versus PMDD app has over 150 symptoms, physical and mental symptoms. that would affect somebody with PMDD. So you have to track it not just in your premenstrual phase, but throughout your cycle. It can be problematic to some individuals who might have irregular periods and or other conditions, say for example PCOS. The interaction between PCOS and PMDD is very fascinating. That research itself is not very clear as to where to draw the boundaries between the interaction. So I think the first step would be to track your symptoms, find somebody who is knowledgeable, mental health professionals or gynecologists, because endocrinologists cannot give you a diagnosis because it's not a hormonal imbalance. It is a disorder where your natural fall and rise of hormones is affecting your interactions with your brain.
All right. So the people are asking if we can write down the website and app name. We will definitely do that. Also, thank you for so much for clearing that up between why you can go to a gynecologist or to a therapist and why not to an endocrinologist. And you raised a very important question that it is not a hormonal disbalance, and now that research is actually very conclusive. In fact, people are always talking about this huge debate that is this a mental health issue, is it a hormonal issue, blah blah blah. You know, so there is a lot of research that talks about that how it's not a hormonal disbalance, but it is a sensitivity to a certain a fluctuation of hormones. So to a lot of people, this distinction is not clear. So can you tell us that when people are facing any kind of PMS symptoms, irritability, stomach ache, all of that, the most important question we are asked is how much is too much? Because subjectivity plays a role. In some cases, like one feels that I myself have felt it, that oh my god, this is so severe, I think like something's going to happen to me and I'm going to collapse. But it actually increases, like 2 or 3 months later it increased, and I was like, I thought that was a lot, but this is a lot. So how do we tell ourselves and how do we tell the doctor that it's a lot of pain, it's extreme pain? So yeah.
All right. So I think that's one of the questions that women ask a lot, especially. I mean, there are individuals who are assigned female at birth who do experience PMDD, and you don't see them asking that question a lot. It's only women, because women are gaslit so many times and they're told, okay, that's not that bad. Your period pain's not that bad. Your hair fall's not that bad. Oh, no, you're not gaining weight. And, all of these things, you're gaslit and you're so paranoid that you are forced to question your own experiences. So when it comes to understanding what is too much, is that it's subjective. It's different from one person to another person. No PMDD journey or no PMDD diagnosis is same. It's really heartbreaking to hear that question. But let me tell you how you can differentiate it. Is that, does it impact your everyday activities? If you have moderate PMS, like say a little bit of breast tenderness or irritability that doesn't, affect and change your life in a drastic way. And by drastic, I mean like not, again, it doesn't have to be like you quit your job, you broke off with your husband and you just took off. It doesn't have to be like that. Does it test your will to get out of the bed and get things done? That is enough. If you find it difficult to get out of your bed and get things done during your premenstrual phase, that means that you have a higher chance that you might be suffering from such intense symptoms that you might have PMDD. And what's interesting here is that you have physical symptoms and the mood symptoms that affect you. Some people, the physical symptoms are really high. They have joint pains, they have breast pains so bad. For example, myself, I have very bad breast tenderness and water retention in my breast that I actually use a different cup bra for my premenstrual phase, because that's how bad it is. But for some people, physical symptoms are not all that bad. It's uh, the mood symptoms or the mental symptoms. And there are wide range. When I say 150 symptoms, can you imagine? And obviously your environmental cues, your genetics will play a role in how you experience PMDD. But if it is affecting your everyday activities, if it's affecting your ability to get up and do housework or go to work or even be social, then you have to seek help, because that intensity is high. It's affecting your quality of life.
All right. So, we get this question in different formats and in different ways. The anxiety about medication, the fact that medication means oral contraceptive pills, or medication means, some irreversible hormonal change. And, people are, sometimes home remedies and all these things definitely help. There's no doubt about it. But sometimes it needs much more. So, how do we understand this journey of medication for PMDD in a better manner and in a healthier manner? The fear of medication, the irreversibility of medication, and the biggest fear, which somebody has also asked over here, is that is it at all sustainable? What are some dietary changes and environmental changes that we can actually make to sustain this?
All right. So when it comes to PMDD, lifestyle changes are pretty much recommended, because exercise will increase flow to your brain, which will help your GABA system. It's the GABA system that's most affected by your increase in estrogen or progesterone. So when you exercise and you get the blood flowing towards your brain, it shows that even a 20-minute walk increases the amount of activation in your GABA system. So that's good. You have to walk, you can do yoga. All of these things there's evidence that it helps. Yoga helps, there's evidence for that. There's evidence that walking helps, there's evidence that exercise helps. There's also evidence that diet plays a role. For example, if you take too much of sodium, you are expected to have breast tenderness. That doesn't mean that by reducing sodium it automatically is going to decrease, but it's obviously going to help you with the intensity of the symptom. Same thing with exercise and yoga and micronutrient deficiency like zinc, potassium, magnesium, vitamin C, vitamin D, all of these things. Very important, because micronutrition deficiency, I mean, there is mixed evidence, but that mixed evidence is enough for us to understand that there might be a link between microdeficiency and, micronutrient deficiency and mental health response. And in fact, micronutrient deficiency is called as hidden hunger. Your body is actually hungry for these micronutrient deficiencies and you don't even know. Now, what happens here is that all of these remedies work and they're good, but that doesn't mean that you don't require medical attention. With PMDD, currently the drug that's specifically made for PMDD is under clinical trials. And the first phase of clinical trials are out, but it's not looking that good with the approvals. But as of now, there are three options for medicine. One is oral contraceptive pills, which personally I don't think is something women should take, because there are instances in women with PMDD who have taken the oral contraceptive pills and that only made it worse. Because a lot of women with PMDD have something called progesterone sensitivity. So if there's increased progesterone in your body, it's only going to get worse. And progesterone is something that calms you down generally. But women with PMDD, it has complete opposite effect. It's not a calming hormone. So you do not want to take something with progesterone. And generally, oral contraceptive pills also come with a lot of side effects, which, I don't think there is such thing as informed choice when it comes to oral contraceptive pills. Now, you have SSRIs, which are essentially antidepressants. What is recommended is that you take them the moment you start exhibiting your premenstrual symptoms. And it helped for some of women, but what happens is after a point of time, you might have to just keep increasing your dose, or you reach a point where it's not working for you anymore. You have to change the brand, you have to change the dosage, or you might even reach a point where it's making it worse. And the final option is very, very debated option, which a lot of women surprisingly take because their PMDD symptoms are so debilitating that they don't want to risk it. It's surgical menopause or chemical menopause. There is a special focus, I mean, there's a special peer support group for women who underwent surgical or chemical menopause with PMDD. And honestly, I would say again, it's a little bit mixed because you do not want to induce menopause. But if somebody makes that choice with all the informed decision and informed consent that they know what they're getting into and they prefer being in menopause than going through the symptoms of PMDD, I think it's their choice. But yes, they should be given all information. I personally would suggest therapy. I had CBT and I had DBT and I had ERDM. These really help because, and the funny thing about all these therapies is that you need a person to do it, and these therapy techniques change over time because suddenly what CBT technique was working for you will stop working because your brain has figured out that, you know what, she's manipulating me, I'm not going to let it happen. So you need to go through therapy again and again, and it's very, very cathartic. And I mean, it's silly to just assume that sometimes the intensity of symptoms that one feel can also be because of the environment somebody is in. Say that you come out of a stressful environment, a stressful job, and your symptoms are less intense. That means that that is one of the factors. When you're looking at PMDD, it's not just about the biomedical process. It's also about the psychological factors and the sociological factors that are affecting PMDD. If you are in, if you change into a stressful job, or if you're in a bad relationship, all of these will affect how intense you feel these emotions, because it's about the psychological and the sociological connection between the biological uh, systems.
You raised a very important point about how a lot of people, they are in so much pain that they choose, medically induced or chemically induced menopause instead. Now, can you talk a little more about how, you know, people sometimes what happens is that we were discussing yesterday that a lot of people are in pain, and pain is something that is so difficult to explain to a person, and at that time, often people become so desperate to get rid of the pain and so desperate to feel normal again, so to speak, that it's very easy to fall prey to some not very good practitioners. And these days, there is a spiritual gaslighting of women that is also happening, where often women, and the fact that they are holding on to grudges and not resolving their trauma, I don't know, there's a lot of blame game that happens that is reflected back on women when they're trying to get any medical help. And that is something that we find very, very worrisome. So when people are going to a person who is, like, they can be, yoga practitioners or whatever, there's a lot of spiritual talk. What are some red flags, that people should listen to? Because, like you rightly said, there is a lot of evidence for yoga, but not every practitioner out there is rights based. Not every practitioner out there is, looking at health in a very real sort of way. So, what are some red flags that women should be very, very careful about when choosing a practitioner and, taking control of the evidence?
All right. I think the biggest red flag would be cure. There is no such thing as cure to PMDD. There is no such thing as cure to PCOS. If somebody is telling you, I'm going to cure your PMDD, I think you should report them to the police, because honestly, they are lying. And they are playing with your feelings, your vulnerabilities. They are making money out of you, and you should not fall prey for it. Second thing is detox. That is one word. The only detox that happens in your body is from your liver. That's it. If somebody is using the word detox or bad food or good food, there's no such thing as bad food or good food. You might have intolerance towards certain type of food, but that doesn't mean that food is bad. It's bad for you. And you need to figure that out through a process of elimination. But if somebody is using these terms, especially bad food, good food, cure, detox, these things are biggest red flags. And if somebody is telling you about chakras and aligning them, or if they tell you that you need to align your cycles to the moon and the earth cycles so that you're in sync with the nature, and then all of it will somehow just disappear, I think they are lying a lot. There is a line between indigenous practices and practices that are I don't know. I mean, I don't even have a word for it because they're literally fake. They're just fake. And if it works for you, good. But the reason why it works for you is probably because it's placebo. One of the reasons why the PMDD drug that is on trial has such bad results is because the placebo group is getting as better as the group who's receiving the treatment. And placebo is very important because one, and there is so much evidence as to how good placebo is, because it really helps. If people believe that they are getting cured, it helps. In fact, there's one study that I want to cite, which is very unethical. There was a doctor who did a heart surgery on patients with same disease. In some of the patients, he just cut open and stitched back up. And these patients were recovering as well as patients who received this expensive surgery. And he said that as long as patients believe it, we don't really have to go through the expensive surgery because placebo is working. And this was in the 1900s. He proved the power of placebo, but he got away because there were no ethics committee at that time. You try to do that now, it's not possible. I mean, one of the things that you need to look out for is that yoga, calming, or let's say some Ayurvedic elements which have proven to have properties that help you with inflammation or irritation and things like that are fine. But you need to understand that there are going to be people who are there to just get money off of you, especially in case of endometriosis. I have seen so many people claim to have cured endometriosis. It's such a painful disease that gynecologists who are not trained cannot even identify the lesions, and you are claiming that if I get this yoni steamed, I mean, if I get my vagina steamed, that my endometriosis is going to disappear. You can't steam your vagina. I don't understand these practices. They've become popular. There is difference between alternative medicine and there's difference between medicine that it's not even medicine. Some practices and voodoo and things that have become, people want to be more indigenous, and in that process, they're forgetting that there are some indigenous practices that are not good. Sati was an indigenous practice. It's not good. So you need to do your research. Don't fall prey to such things. Ask a friend, ask another expert, do your research. Google Scholar is available. It'll tell you the current research that is there, and you can see what is there.
Okay. Okay. So, you know, thank you so much for making a distinction between what is indigenous and what is actually very reductive of women's pain and women's experience. And I think this is something very important to a lot of people who have asked us across various this thing that does Ayurveda consider this bad? Does Ayurveda consider that bad? All of that. Now, what I'm hearing is, and which is something that I also agree as somebody who's experienced, several things, that there are good and bad practitioners no matter what you look for, whether it is homeopathy, Ayurveda, yoga, meditation, whatever it is. There are some practitioners who are good and there are some practitioners who are not good. And we understand that it's extremely difficult to find the good practitioners all the time, but it is worth the effort. In addition to what Anuhya said, that those red flags, I would like to remind you what Amrita and Huda also said. Anybody who is asking for any kind of extreme measures, that's a huge red flag. If they say, this is bad for you, stop doing it forever, that's not a very sensitive way of treatment. I think the most indigenous thing, if you're talking about indigenous wisdom, the most, I mean, the wisest indigenous thing that we have got is the notion of balance, and the notion of what they say, sanyam and sthirta. Everything that we have to do, it has to be in a balanced way, in a staggered way. We have to see whether our body is responding. We have to see whether our body is, it's suiting or not. And only then we go ahead with this. Now, before I ask you the next question, Anuya, a lot of our attendees are very insistently asking the name of the app and the website and everything that you suggested. If you can just very clearly, and if you can like spell it out or something or type it out in the chat, I think that will be very useful.
I'll type it out in the chat. Is that fine?
It'll actually be useful if you also say it, because we'll be recording. And
all right, it's me space we space PMDD. You can find that app both in iOS as well as Android. Now the website is, you can go to www.beyondblood.org, or alternatively you can also go to www.iapmd.org. With BeyondBlood, we are trying to take all the resources. So we are actually collaborating with IAPMD, which is International Association for Premenstrual Disorders, where we are converting all of the PMDD resources into Indian languages. We were able to do it for Telugu, Tamil, Kannada. Currently, Hindi is happening, Marathi is happening, Odia is happening. And the reason why we're doing this is because it's not only women who can speak English who suffer from PMDD, and we want this information accessible.
Okay. We have the last, 5 minutes, because I have to play the next video after this. So, Anuya, if you could tell us very quickly, what are some ways of just making yourself feel whole again when you feel so affected and so deeply, characterized by the pain that you're feeling every day? We've spoken a lot about support groups and communities, but it is so difficult sometimes to just go out and even ask for help. And people who have faced this excruciating pain will definitely understand this. So whether it's PMDD, PMS, the cyclical nature of it is even more annoying. What are some ways in which you have used some ways, like using oils and stuff like that? There is now evidence for essential oils as well. So what are some ways in which you have just made yourself feel a little, the little spark again when you feel so affected by the pain and by the hopelessness and the unfairness of it all, and you've then taken the next step to ask for help or to seek help? If you can just quickly tell us.
All right. The disclaimer is that just because it worked for me, that doesn't mean it's going to work for other women who have PMDD. When I first was diagnosed, I was extremely suicidal. I checked into a health facility for 3 days because my doctor suggested that I was at extreme risk and that she would rather have me where I can be monitored. And I was in there for 3 days, and my period came after that, and it was good because I just started it. For me, it took almost 6 months to actually start seeing differences. And in the 6 months, I tried a lot of things. One of the biggest thing I did was exercise. That's the biggest change I made, is that I made it a point to at least get 3 days of exercise in a week. The second thing I did was micronutrients. I realized that one of the micronutrients I was taking a lot was iodine. I didn't need that much iodine, and iodine can impact my thyroid, which impacts my hormones, and which also impacts my neurotransmitters. So I very carefully monitor my iodine intake, because it's very easy to take a lot of iodine because of salt is iodized. And I took zinc, magnesium, I took vitamin D a lot because I wasn't getting enough of it. I I did that with a lot of micronutrients. Then, apart from micronutrients, I didn't change much in my diet other than, like I said, less sodium because I was getting a lot of iodine. I pretty much I gave into my cravings. So in during PMDD, one of the things that women complain a lot is cravings. I'm like, if I'm going through so much of mental pain, I'm not going to stop myself from eating cake. If the cake is what's going to save me, get me through the day, I'm not going to stop. I'm not going to feel guilty for my cravings because you know what? I'm going to exercise it in my follicular phase when all my hormones are happy and high. But I'm not going to stop myself from craving. And you don't have to beat yourself up because cravings control you. You try to stop your cravings and just see how you respond because your body is going to really like it's going to reach a point and it's just going to burst out. So you don't give in to your cravings. It's good, it's actually healthy, and your metabolism increases premenstrually, so that means that you can eat a significantly higher calories than normal. Apart from that, for me therapy really worked a lot. I use a spray from I'm so sorry, I can't recollect the name. It's Karma uh, something. It's an Ayurveda company in India itself. I think Karma Ayurveda. They have this sprays to fall asleep, which really helps me. I use that spray on my neck and on my pillow, which gives me a very soothing experience. One of the things that happened for me with PMDD is that I had increased sensitivity to light, touch, smell, and all of that. So I was very aware. I could taste plastic if I would eat anything from plastic. It was that bad for me. So I realized that my increased sensitivity was one of the factors, so I worked on it. And apart from that, I went to therapy, which is what really worked for me. I was on antidepressants for about 3 months, but after that my therapist felt like I didn't need them anymore, and since then I've just been only on therapy. I use my therapist gives me about 4 different techniques that she alternates and use them depending upon uh, my mental profile for the day I go into therapy. And one of the things that I use every day is CBT, which really works for me. DBT is usually for people who have suicidal ideation, and it's not for everybody, but it's good. And in fact, apart from all these tiny, tiny same changes, one of the things that really helped me, honestly, was to be honest about it, to completely accept what I'm going through and to accept that it's a chronic illness. I'm going to have it for the rest of my life, and managing is the best way to go about it. And that means being very honest with my professors, very honest with my colleagues. In fact, I am going to be a professor at Indian Institute of Health and Management Research. I told them, listen, I have PMDD, and that means that premenstrually I might need more support. I might cancel classes if it's too bad. So it's your choice whether you want to hire me or not. And they still hired me. So I think don't have to beat yourself up about it, because we need reasonable adjustments at workplace because it's a chronic illness. And these reasonable adjustments are given in other countries, whether it's for PMDD or whether it's for diabetes, endometriosis. All of these countries have reasonable adjustments because these flares happen in cyclical manner, and we are lagging behind that. I mean, there are a lot of people, like say in US, who don't hold a job because they cannot, because premenstrually they have executive dysfunction and they cannot hold on to a job, and they're suffering because they don't have that law in place. UK and Europe, women with PMDD are thriving. They're thriving because their companies are giving them reasonable adjustments. And I think it's very important for us also, like, to bring that policy change in India. I mean, when I talk about it, it's not just for PMDD, it's for all chronic illnesses in general.
Yeah, I think, Anuhya, you raised such an important point about navigating workplace, navigating relationships, because speaking of chronic illnesses, there are some brilliant women I know, and there have been some of my personal experiences as well. I think the biggest beating that the confidence takes is because it's not just your work that's suffering, your personal relationship starts suffering too. And you just can't help but just blame yourself, that it's because I'm unwell that I'm not able to take this on and stuff like that. Thea Care, our organization, it's a virtual health coaching and consultation platform for women. We have a panel of experts from all over the country. We will be able to share curated lists to you if you request us. Those of you who are registered attendees, you have our WhatsApp number, you can reach out to us. As far as support groups are concerned, Thea Care is making a support group at the end of May for all people who are going through chronic illnesses, need any dietary support or anything. We are also coming out with a women's health magazine that you can subscribe to, which will pick up top 50 questions every month and answer them in a personalized manner. So all these details will be sent to you via email and via WhatsApp. You can reach out to us for that. When it comes to women's health, the research is very scattered. When I say scattered, it's like in some cases, the research has not been done at all. In some cases, even if the research has been done, a lot of doctors are not aware. In some cases, what happens is that people are seeking help only when they're trying to get pregnant and they're not able to conceive. And so women's health suffers from this problem where everything is related to fertility. And the biggest thing I want to highlight along with the other speakers here today is that all the things that you're hearing about your hormones, it is not just about your uterus. It is not just about your reproductive health. Whether you decide to give birth, whether or not you have given birth or you are planning to do it in a few years, all these hormonal disbalances, all these syndromes, they affect every part of your body. Yesterday, we released a video about ovulation and we spoke about why, all the hormones are so important for cardiovascular health, mental health, metabolic health, bone health, brain health, sleep quality, so much. So when we're looking at women's health, we have to start looking at it as a public health issue, and we have to start looking at it as something much more than just your fertility. The fertility is a part of it. It is in fact so much more important than your digestive health, because without your digestive health, you are unhealthy, whether or not you give birth or you choose not to give birth.